Hello everyone. Myself Saha. I'm an assistant professor from the Department of Pharmaceutical Technology, JISU University. Today I'm going to talk about a subject of basic and clinical pharmacology. As a topic of, it's a subject of BMLT second year, and we are going to talk about the topic cholinergic drugs, which is having a subject code BML 304. So before moving on to our topic, we need to know what is the objective of the topic, why we should study the topic, what is the significance of the topic. So let's see what it is. So the objective, this chapter will let you know about the various receptors related to the parasympathetic nervous system. I'm sure all of you know that there is another nervous system that is sympathetic nervous system, and this one is a parasympathetic nervous system. So we'll be talking about the receptor which is which is dealing in the parasympathetic nervous system and drugs associated in the cholinergic system, their mode of action, that is how they're working, their therapeutic uses, importance, their pharmacokinetics and pharmacodynamics. So all this information we'll be studying in brief today. Parasympathetic nervous system, it works to save the energy, it aids in digestion, supports restorative and resting body function. It helps in decreasing the heart rate, it increases the gastrointestinal tract tone and peristalsis, urinary sphincter relaxation, vasodilation, that is it decreases the it increases the size of the blood vessels, that's why it decreases the blood pressure. So parasympathetic nervous system basically calls rest and digest the nervous system, where when humans are in a resting position and we are digesting at the resting position, that time the nervous system helps to do that. That nervous system basically calls parasympathetic nervous system. And sympathetic nervous system, let me just tell you, it calls fight and flight, because that the time when we are excited, that nervous system comes into play. Body response, that's what I said, rest and digest. Dilation of blood vessels in skin, decreased heart rate, that is called bradycardia. On the contrary, whenever the heart rate increases, that is called tachycardia. Increased secretion of digestive enzymes, constitution of smooth muscles of bronchi, constriction of smooth muscles of bronchi. In the bronchus muscle, whenever the constriction happens, that time proper inhalation and exhalation takes place. Like you can inhale the proper amount of air and you can exhale the carbonated air. So to do this parallelly, you need a proper constriction of the smooth muscles of bronchi. Bronchi is the lungs. It increases in the sweat glands, because sweating is very, very important, because if you're sweating, that first the thing is your toxins, the wastage material from your body is going out, and due to latent heat, your body becoming cooled. So the temperature of your body is getting down. Contraction of smooth muscles of urinary bladder, contraction of smooth muscles of skeletal muscles. So these are the basic responses of cholinergic nervous system. These are the cholinergic receptor, very important to remember and know, because these are the receptor that that shows different actions in rest and digest. So let me just briefly discuss one by one. But whenever you are studying this receptor, firstly the thing you need to know the name of the receptor, and then secondly the thing you need to know is the where it is position, where is the location of the receptor, and what is its basic function. So first is muscarinic receptor, and second one is in the broad heading. First is muscarinic, and the second one is nicotinic. Muscarinic is being muscarinic is being termed by written by M, and nicotinic is being written by N. So M is being, like, muscarinic is being classified into three: M1, M2, and M3, and nicotinic is being classified into two, that is NM and NN. Okay. M1 is in the secretory gland. Secretory, that could be a sweat gland, that could be sebaceous gland, that could be, and that is also in the gastric acid secretory, from where the gastric acid in our stomach secretes the gastric acid, that is a hydrochloric acid. So here you can see salivation, stomach acid, sweating, lacrimation. So whenever a baby is, whenever a mother is lactating her baby, so that also, there also M1 receptor comes into play. M2 can be found in heart muscles, which decreases the heart rate and which causes the bradycardia. Then comes M3. M3 is in smooth muscles. It is also in pupil and ciliary muscles. What it does is, it basically helps in contraction of smooth muscles. It can cause diarrhea. It can cause bronchospasm, urination. It also can cause meiosis, where the pupil diameter, used to get less. And mydriasis, on the contrary, mydriasis is when the pupil diameter used to be big. That is called mydriasis, and the meiosis when the pupil diameter used to get less. NM. So here how you are going to remember NM. M for muscles. M stands for muscles. So it is in the, we have already spoken about smooth muscles, so it will be some other category of muscle. What will be that? Skeletal muscles. So NM for nicotinic skeletal muscle. These are the nicotinic receptor, which is present in the skeletal muscle. It helps in the contraction of skeletal muscle. NN. N stands for neuron. So autonomic ganglia and adrenal medulla. In these two locations, you can find an N receptor, and it helps in secretion of epinephrine, that is adrenaline, and control ANS. It also controls autonomic nervous system. Cholinergic drugs are often called parasympathomimetic drug because they act, they mimic the action of PSNS, postsynaptic nervous system, or parasympathetic nervous system. Because sympathomimetic, mimetic means something you are copying. So it is basically cholinergic drug mimicking or showing the same action like parasympathetic drug. So that's why cholinergic drug can be called as parasympathomimetic drug, and adrenergic drug calls sympathomimetic drug. Okay, and parasympathetic drug can also be called as sympatholytic drug because it basically acts just opposite to the adrenergic drug. So you can say sympatholytic drug as well. It can also be called cholinomimetic. Stimulate the parasympathetic nervous system in the same manner as does acetylcholine. It may stimulate cholinergic receptor directly or slow acetylcholine metabolism at synapse. Synapse is the synaptic cleft. It's a junction between the two neurons. There's one presynaptic neuron, another postsynaptic neuron. This middle portion can be called a synapse or synaptic cleft. Cholinergic agonists are two types, direct acting and indirect acting. So this is the basic classification of cholinergic drug. As you can see, cholinergic agonists are there, which is agonist means which is showing the same action, which potentiate the action of particular receptor. So cholinesters are there, that is acetylcholine, methacholine, carbachol, bethanechol. Alkaloids, some alkaloids are there, like natural alkaloids, pilocarpine, muscarine, arecholine, etc. And anticholinesterase, anticholinesterase is also cholinomimetic drug or parasympathomimetic because cholinesterase is an enzyme which breaks down the acetylcholine. Remember, again I'm repeating, cholinesterase is an enzyme which breaks down the acetylcholine. So it is cholinesterase acts against the acetylcholine. So whenever there is something against cholinesterase, so that will be that will be in the support of cholinergic drug. Because if there is some anticholinesterase which is preventing the cholinesterase to break down the acetylcholine, so that means acetylcholine will be restored. So anticholinesterase can also be called as cholinomimetic drug or parasympathomimetic drug. This is two types, reversible and irreversible. In the reversible, there is carbamate and acridine. In the example of carbamate, there is physostigmine. All the stigmines, physostigmine, neostigmine, pyridostigmines, all these stigmines are carbamates. Acridine, there is tacrine. The irreversible carbamates are carbaryl, organophosphates, very, very important. That is diplos, malathion, diathion, tabune, serine, soman. All these are irreversible. And the last three which I have mentioned, tabune, serine, and soman, these are the nerve gases, which generally be used in the some war. In case of some war, some this kind of chemical gases, nerve gases, are being used. Direct acting cholinergic agonist. They act by binding directly to cholinergic, that is cholinergic receptor like M1, M2, M3, and MNN. Direct acting cholinergics are lipids insoluble. So it is not soluble in lipid. Do not readily enter CNS, because to enter to the CNS, to enter in the brain, or to cross the BBB, that is blood-brain barrier, I have already told in previous classes that uh, to penetrate or to enter or to go through the blood-brain barrier, the substance needs to have a high lipid solubility. And as it is already been said that it is lipid insoluble, so it cannot cross the CNS, central nervous system. It is resistant to metabolism by acetylcholinesterase. Effects are no longer acting. Effects are longer acting than as with acetylcholine. Like if you compare with acetylcholine, it shows more longer action. Like methacholine, carbachol, bethanechol, muscarine, pilocarpine are arecholine, etc. Drugs effects of cholinergic agent. Cardiovascular effects. So how this cholinergic drugs shows effects in different system like cholinergic or so respiratory system or gastrointestinal tract, so on and so. So decrease the heart rate because it's showing action through M2 receptor. It is in the heart. It's causing bradycardia, vasodilation. It is causing nitric oxide mediator because nitric oxide itself is a vasodilatory molecule. It stimulates intestine and bladder, increase gastric secretion through M1 receptor, increase gastrointestinal motility through M2 receptor, increase urinary frequency. I'm so sorry, increase gastrointestinal motility through M3 receptor because that is in the smooth muscles. Increase urinary frequency, it shows that some diuretic property, like urination gets doubled. Stimulate pupil, constriction of pupil. That's when meiosis happens. Meiosis, I already told that meiosis means constriction of the pupil diameter. So the pupil diameter used to be less. Spasm of accommodation, reduced intraocular pressure. Intraocular pressure means the pressure inside the eye. So it generally used to be 21 millimeter Hg. So when the pressure increase, that time that pressure may create damage in the optic nerve, and that may cause glaucoma and other problem, retinal damage and all. So it also helps, this cholinergic agent also helps in the reduction of intraocular pressure. Respiratory effect, bronchial constriction, constriction of the smooth muscle in the lungs, narrowed airways. As it is constricting the smooth muscle in the lung, so it is narrowing the airways. Increased salivation and sweating because it is in the M1 receptor. M1 receptor is in the secretory glands, and saliva or sweat is secretes from secretory glands like saliva gland and sweat gland. Drug effects of cholinergic agent. So how we'll be able to remember this? So there's a small formula that helped me to remember all these effects. So it may help all of you. So that's the reason to think about it. I have given that you may use. It's not mandatory that you have to use, but you may use. So many smart, the formula is many smart ladies ultimately bring disaster for dudes. It's a very catchy line. I'm sure you guys, some of you will agree, some of you will not. And it's a kind of, crazy line, I'm sure. So many smart ladies ultimately bring disaster for dudes. So we'll be taking, so keep this line in your brain, and you have to pick only the first letter of each word. So many is M, so it causes meiosis. Smart, S, salivation. Ladies, L, lacrimation, ultimately U, urination, ring, B, bronchoconstriction, D, disaster from D from disaster, defection, DUDS, D from DUDS, decreased heart rate. So these are the effect of cholinergic agent. Some, some of the effects, not all, some of the effects. Now we'll talk about the neurotransmitter which is in the cholinergic nervous system, that is acetylcholine. That is one of the most important thing to talk about. One of the main neurotransmitter of ANS, autonomic nervous system, is acetylcholine. Acetylcholine is released at preganglionic fibers of both sympathetic and parasympathetic nervous system. Also released from postganglionic sympathetic neurons that innervate the sweat glands and from motor neurons that innervate the skeletal muscles. It is a quaternary ammonium compound, so cannot penetrate the membrane. As it is a quaternary ammonium compound, it cannot penetrate the membrane all the time. Does not have any therapeutic importance because rapid inactivation by acetylcholinesterase. Very important, in the synaptic cleft, in the synaptic junction, you can find the acetylcholinesterase, that's the enzyme, which may decrease, or which may degrade the acetylcholine itself. It has both muscarinic and nicotinic action. Obviously, because it's it's a parasympathetic neurotransmitter. In the parasympathetic nervous system, there is two type of receptor, muscarinic and nicotinic. So definitely the acetylcholine will be having the action on both muscarinic and nicotinic. Bethanechol, one of the important thing, not hydrolyzed by acetylcholinesterase. So it's very important that the problem with acetylcholine we had, that it used to get hydrolyzed or degraded by acetylcholinesterase. It will not, the same thing will not happen in case of this bethanechol. Actions directly stimulates M receptor, that is muscarinic receptor, causing increased intestinal motility and tone. It stimulates detrussion muscles of bladder, while trigone and sphincter are relaxed, causing expulsion of urine. Its therapeutic use, it is used in paralytic ileus, urinary retention. It's helpful in the post-surgical atony of bladder and GI tract. Pilocarpine. An alkaloid, lipid soluble, is stable to hydrolysis by cholinesterase. It's an alkaloid, it's also lipid soluble, so that's great that it can penetrate the central nervous system, and it's stable to hydrolysis by cholinesterase. It does not degrade by the hydrolysis of cholinesterase. When applied locally to cornea, produces rapid meiosis, decreases the pupil diameter, and contraction of ciliary muscles, produce spasm of accommodation, and vision is fixed at particular distance, making it impossible to focus so far to the situated object. So due to the meiosis, the volunteer to whom we are putting the drug or the pilocarpine, for a period of time, that person will not be able to see the object which is far away from him, from his eyesight. Therapeutic use. In glaucoma, it opens trabecular meshwork around the Slem canal. It causes drainage of aqueous humor. Intraocular pressure, that is IOP, means intraocular pressure or intraocular tension, you can say. I just have told in the previous slide what is that. So intraocular pressure immediately decreases. So in case of glaucoma, you can use pilocarpine. Indirect acting cholinergic agonist. They act through inhibition of acetylcholinesterase enzyme, so increases the acetylcholine level in the synapse. Accumulation of acetylcholine then occurs, which enhance the activation of nicotinic and muscarinic receptors. Anticholinesterase drugs are either reversible or irreversible inhibitor of acetylcholinesterase. So anticholinesterase drugs are the inhibitor or reversible or irreversible inhibitor of acetylcholinesterase, because anticholinesterase, which is actually supporting the supporting the acetylcholine, which is these drugs are basically reversibly or irreversibly support the inhibitor of acetylcholinesterase. So these are some examples. We have already discussed about it. Reversible neostigmine, peridose, all these stigmines are reversible. Irreversibles are organophosphates, very, very important. Tabune, serine, all these are nerve gases, which is basically used in warfare. And carbamazine, carbaryl. Use of indirect cholinergic agonist. It is used in glaucoma. We have already spoken about pilocarpine in glaucoma. Physostigmine, that's an anticholinesterase, reversible anticholinesterase. The difference between the reversible and irreversible is it takes time to recover. In case of irreversible, lot of time. In case of reversible, it gives a very fast recovery of enzyme cholinesterase. Edrophonium to test myasthenia gravis. Stigmine and pyridostigmine in the treatment of myasthenia gravis. Myasthenia gravis is nothing; it's an autoimmune disease. Whenever excessive autoimmune disease, nothing that your body itself produces immunity like antibody, which works against your immune system. So we'll discuss about it later, definitely. Post-operative paralytic ileus in neostigmine helps. Post-operative decurarization, neostigmine, which reverses the muscle paralysis. Decurarization, whenever you are being paralyzed by the help of detubocurarine, it's a nerve, neuromuscular blocking agent. That time, neostigmine can be helpful to reverse the muscle paralysis or muscle cramp or tremor. It helps to reverse back. Cobra bite, edrophonium can be helpful. Atropine poisoning, physostigmine can be helpful. Alzheimer's disease, donepezil, tacrine, rivastigmine can be used. So all these drugs can be used. Even TC or phenothiazine overdose. In case of phenothiazine overdose, we can also use as an antidote. You can say physostigmine. Cholinergic agent side effect. Side effects are result of overstimulation of the PSNS, that is parasympathetic nervous system. For example, in the cardiovascular system, bradycardia, hypotension, conduction of abnormalities, nerve impulse conduction abnormalities can be seen. In case of CNS, headache, dizziness, convulsions can be seen in the case of gastrointestinal tract, abdominal cramps in the stomach, increase the secretion of gastric acid, nausea, vomiting may also take place. Cholinergic agent side effect, respiratory, increase the bronchial secretion, it causes the bronchospasm. Other is lacrimation, sweating, salivation, loss of binocular accommodation, myopia. Binocular accommodation means you won't be able to see through your two eyes, like some disturbance will be there whenever you are trying to see through your two eyes. So this was the cholinergic effect, agent side effects. And the cholinergic crisis is very important terminology in the cholinergic nervous system and cholinergic drug. Whenever we are talking about cholinergic drug, so it basically occurs because of irreversible anticholinesterase poisons, which binds to the enzyme acetylcholinesterase and inactivates it. That acetylcholine remains in the cholinergic synapse and causing the excessive stimulation of muscarinic and nicotinic receptor. This is because of irreversible anticholinesterase, because anticholinesterase is blocking the cholinesterase enzyme and it is irreversible because it takes a lot of time to recover or to make the enzyme cholinesterase free. If the cholinesterase enzyme is not free, that means the activity of acetylcholine used to be increased. So the concentration of acetylcholine in the synaptic cleft or synapse, the junction between the two neurons used to be very high. The concentration used to be very high of acetylcholine in the synaptic cleft. And if the concentration is very high, its action will be very, very high. Overstimulation of muscarinic and nicotinic receptor can be seen. So that is called cholinergic crisis, because We are trying to do something good, but due to overdoing it, we are getting some negative effects. So that's why I used to say that nothing should be done in, without, nothing should be done beyond the limit. Everything should be done within the limit. So that's what is example or, significant about the cholinergic crisis. So this was for today, and though cholinergic system is a vast chapter to talk about, it is having a lot of things to talk about, but it's not possible for one class to talk about all these things. And in your syllabus even, uh, everything is like the detailed study is not there. So this had overview you have to understand. You have to understand, uh, you have to keep in mind the drugs and how it is working, why it is important, why these drugs are important, how it is showing some action, how when you can use these drugs and when you should not. So all these therapeutic uses, limitations, you need to know, but not in detail, in the overview way. And this is for today. And I hope you have understood what I tried to imply, what I tried to make all of you understand. If you have not, I'll request all of you that please go through my slides twice or thrice. I'm sure you will understand. But after that, if there is, there are any kind of doubts or confusion exist, we'll be discussing that in the next class. Okay. Thank you so much.